Hello, operator. I'd like to place a collect call to Dave or Mary at this number. Jeff. Thanks. Hello, Dad. Hi. Yeah, I'm fine. It's Gramps. That's why I'm calling so late. Well, he had a fall. I don't know. I came home from work and found Grandma yelling down the stairs to him. She was frantic. He'd gone down to see if the cat had gotten locked in down there, and Grandma said she heard him fall. Yeah, I know he's not supposed to go down there. He knows that. We've all told him that. What do you want from me? I was at work. Anyway, I called the ambulance. As a matter of fact, I just got back from the hospital. Yeah, Grandma's gonna stay with him tonight. He broke his hip. Yeah, the doc said he was lucky. Yeah, they're gonna operate. Anyway, he'll be in the hospital a week or two. Grandma's shaken up, but she's all right. Yeah, 10 to 12 days. Yeah, they also said he might want to have a nurse at home for a while until he can deal with the hip. Yeah, but I could take time off work if I need to. Well, he's not going to want to spend the money on a nurse. You should hear him about the hospital already. So what are we going to do with Gramps? No, Dad, I don't think you need to fly down. I'll give you a call if things get worse, or Grandma can always call, you know. Yeah. Oh, yeah. He's at St. Gregory's, room 411. But I don't think you can get through right now. It's a little bit late. Yeah, 8:30 or 9 in the morning sounds good. I'm going to call first thing myself. Sure, I'll do my best. I'll keep you posted, I promise. No, I'm fine, just tired. Yeah, I need to go to bed. I've got to get up early and go to work tomorrow. Yeah. Well, say hi to Mom for me. All right, I'll be in touch. Bye.
Dave, is that you?
Yep, it's me.
You're just in time. Listen, I'm making sandwiches for lunch.
Boy, am I bushed.
Well, are they finally settled in?
I guess so. We've got most of the big stuff in at least.
How does Grandpa like his new walker?
I guess it's okay. Mom was hoping that her one and only granddaughter would come down and visit with her today. By the way, where is Holly?
I think she's in the den watching TV. Oh, that reminds me, I better get the chips here.
Is that all these kids can do on Saturdays these days? Watch cartoons? Why isn't she outside playing with the rest of her kid friends?
There's no sense in forcing her, Dave. She needs to do things because she wants to.
She doesn't want to visit with her grandparents?
Well, you know, it's not exactly easy. I mean, after all, they can't play with her anymore. They can hardly even move around. And besides, what do old folks and 10-year-olds have to talk about anyway?
They're her grandparents. They love her.
I know, and she loves them too. I guess she just doesn't know what to do with them.
That's a darn terrible comment to make.
Well, look, you don't exactly know what to do with them, and they're your parents. And I know I don't know what to do with them. Look at how hard it was to decide to sell their house, bring them down here, and then to decide if they were going to stay here or in an apartment or a nursing home.
No, you mean apartment or a nursing home. You never wanted him to come to live with us.
Come on, Dave. Did you? I don't think it would have worked out. Do you?
They could have taken Jeff's room now that he's gone to school.
That's not the problem, and you know it. It was hard enough to get along with my mother when we had her here. Besides, it gets too close for comfort. After all, they want their independence, and so do I. Holly! Come eat! They're going to be all right, Dave, you'll see. I mean, they've got a cozy, comfortable apartment. It's in a good part of town with a neighborhood watch and an outreach program for the elderly. Lord only knows they've got more public services available here than they would have had in that rinky-dink little town where they came from. Holly! Lunch! Wash your hands! It's gonna be all right. They can always call on us. You know that.
Yeah, right.
Hello, ladies and gentlemen. Welcome to today's discussion on senior issues. What will we do with Gramps? Our focus today will be on community resources for the elderly. I'm Lena Adams from Audie Murphy VA Hospital, and our guests that I would like you to meet today are Mrs. Ann Butler, who is the Program Director of Community Care Services for the Aged and Disabled, Texas Department of Human Resources, Mrs. Nancy Bowman, who's the Administrator for the Office on Aging for the City of San Antonio Department of Human Resources, and Mrs. Johnny Davis, who is a medical social worker in the Geriatric Evaluation Unit at Audie Murphy VA Hospital. Welcome, ladies.
Thank you.
Mrs. Davis, in having seen the first segment of What Will We Do with Gramps, I'm wondering if the home health care could have helped this couple, and just what is home health care?
Certainly, I feel that home health care would have been of great assistance with this couple in terms of when Gramps was ready to come home from the hospital. We look at home health care having skilled care needs versus home health care or home health aides, or looking at a homemaker type service to support them within the home. A home health care agency could possibly go in and do teaching in terms of how Gramps can be cared for, so that someone who does not have to have skilled care could provide that service. So you look at the teaching aspect, as well as the evaluation of the home, thinking in terms of safety factors, looking at equipment needs, also looking at what orders have been written for Gramps and carrying out those if there's physical therapy that's involved. There are all kinds of issues that need to be looked at within that home, but there are certainly some supports that could have been provided by home health care agencies.
And how would these services may have been paid for?
If they were not able to pay for them, they might have applied to the Texas Department of Human Services or to the city for resources, because we provide some of these home health services also at no cost to clients if they're eligible, if they're financially eligible for the services.
And I think also mentioning that through Medicare, you know, if they have the Medicare coverage and they are meeting the other requirements in terms of skilled care needs and having a physician's prescription that they are supposed to have these kinds of services, be it equipment or skilled home health care needs. I think that's certainly one resource that we depend on.
They might have been eligible also for Medicaid, which is different from Medicare. It is a lower income. As you're aware, Medicare is available to anyone older or disabled, but the Medicaid services would be available to low-income persons.
And there's still some that they fall into the gap between, say, Medicare and Texas Department of Human Resources, but other homemaker services.
City services.
And there are private agencies that also offer home health care when there's not as much of a criteria being placed on what the person's income might be. And then there are ancillary services in the community that would help fill in the gap while one is being qualified for home health care, for instance. The family could perhaps have brought on the services of the Visiting Nurse Association. They would assist in many of the kinds of things that has to do with the medical provisions that the doctor's orders would have stated for this family group. They would also assist in other ways of making referrals for services in the community. Then they may have wanted to go through their church or some of the auxiliary groups that operate with agencies that they might belong to, who have the kind of services that would help them become oriented to the fact that they are now in a different level of living and still enable them to remain in their own homes.
I'm aware that there are what are called co-ops within our community that are volunteer agencies. These could help like with transportation or sometimes even home repairs. Is that true?
That's true. The handyman service or having persons who are going to assist with caring for the yard, because with the person being incapacitated, that's one of the main things that has to go on within a household. Then you're concerned about how you're going to get back and forth to a doctor and being able to do it in a way that you can afford it. And taxi service sometimes is rather costly, so that there are a number of services in the community that will offer transportation.
Another aspect might be nutrition. I'm not sure just how capable the wife was as a care provider, but I know that there are nutrition programs in our city too. Is that so?
That would have been a great help. They could have either had homes delivered, or if they were able, at some point they might have gone for congregate meals, which would have provided a social environment for them also.
Exactly.
That's a real important part of that noontime meal, I think, is a social stimulation that people get.
In addition to the well-balanced meal
Right.
that they're also in need of. So that's,
because many older people cannot eat all that they get at noon, but they take it home for their evening
That's
meal. I've
right. They
noticed.
save it for their later meal.
One of the things that they might have considered too is having friendly visitors who would call them to check on their well-being, let them know that somebody's actually thinking about them, and you have not only friendly visitors. There are services called telephone reassurance. There are the kind of services that will get them registered with programs such as the early alert service that's carried on with the postal carriers. There's a little symbol placed under the mailbox flap, and there's a number. One of the persons that's always in the community is the postman, and if they notice anything out of order, mail not being picked up, the newspapers scattered about, then they call an alert number, and therefore somebody who is registered as a caretaker will get in touch with the family.
I think we are kind of hitting on one of the key issues that I saw being a need for this particular family and situation would probably be some involvement for the family in terms of someone kind of educating them, the couple and the family, in terms of what would be available to kind of prevent or prepare for when something like this happens. There are so many things that can be called into play to keep them as independent as possible within their home before starting to consider, you know, we've had an accident, we've got to move Gramps with us so many miles from home and family. Support groups for adult children of elderly parents in terms of those responsibilities, but also educating this couple in terms of, you know, there are many things that you can benefit from, you know, and you're independent, you're making choices, but just knowing some of the services that would be available.
Right.
A real important place to start that service too is with the medical social worker at the hospital where the hip injury was being treated. They normally will access a number of services and put the person in line with what is going to be necessary in order to receive these services. Therein we have the business of case management begin, and that means that there would be a provision for coordinated services and not have all of us who are in these various agencies sort of running over each other, trying to do the thing that would be from our own particular agency.
So the medical social worker then could determine these people's, this couple's eligibility and their resources as far as income and how much the family could help or not help.
Certainly.
The lifestyle that this family wants to continue to live.
Exactly.
And what they need to maintain that.
It would have been
Exactly.
so much better if they had been able to remain in their own homes because they went through the stress of relocation, which was very stressful for them.
Is that
And-
does that affect a person?
Oh,
relocating?
yes. They have lived in this town probably all their life, and they have friends there, support groups in the community possibly, and they moved away where they knew no one except their son and his family, and
We're
they
going
didn't
to
see
have
them
to
too
stop
often.
right here, and we'll continue this in just a moment. We're going to break. We'll be right back.
So, how you been, Charlie? You know, since Maud.
You're fine.
Haven't seen you out much lately.
You've got nowhere to go.
Sure you have a place to go. Like we came here today with me. You got the mall, you got the center, you got places.
Sure, I got places.
Yeah, how's the hip anyway? Is it good as new?
Good as new.
About ready to go dancing again, Charlie?
Nah, I'm long past that.
Ah, don't say that. Not so.
Who am I going to dance with anyhow? Since Maud's gone.
Well, I'll admit I'm not the handsomest guy in the world, but I can still cut a mean rug.
Sorry, Frank. You're not my type.
Sit down here. You still kind of miss her, don't you?
Yes.
Kids come see you much?
No.
No time for us, huh? They don't really care too much about it. They've got their own lives to live. Say, tell me about that home. Pretty nice place?
No. It killed her.
Killed her? What do you mean? That was a pretty neat place. That was one of the better ones I've seen.
Well, maybe not them, but I don't know. It just seems so fast. Everything happens so fast. They sell our house, and then they put us in an apartment, and then we're just getting comfortable, and then they yank us out, and they stick us in this home just because Morty gets a little sick.
A little sick. She was really sick. A stroke, diabetes. What more could they have done?
Come to see her, damn it. At least come to see her.
They did.
Not enough.
It's never enough.
Yeah, I don't know. It's just not right. You know, other countries, they honor their old folks. And they look at them and learn from them. Oh, but not here. Not in the land of milk and honey. Oh, no. They stick you away in a dark hole as soon as you have no usefulness. And, you know, they just stick us away in a dark hole and forget about it.
That's not so, Charlie. In Washington, there's lots of good things going on. A lot of lobby groups. I belong to an advocacy group. Neat. And those young fellows are learning more every day that we still vote. And what's more than that, lots of folks outside to help you.
Or rob you.
Oh, rob you, so what? So what's different? You know what I think? I think you're still bitter because of Maud.
You bet I am. It seems like no one cares anymore. Not anyone, not even our own kids.
Well, they don't. Who cares? You still have me. The kids may not worry you, but you got us, me, Charlie. I will work it out. You got places to go and things to do. And besides, you only got a bad hip. The rest of you is okay. There's plenty of things to do, Charlie, plenty.
I'm not into basket weaving yet, Frank. Besides, you're younger than I am. Why, you're only 70. You're just a kid yet. For me, I'm 75, Frank, and I can't get around so good anymore. And what's more, I don't really care anymore either.
That may be your real problem, Charlie. You don't care. If you don't care about yourself, care about other people or other things. Maybe a dog, a cat, or if you can't handle that, a guppy. Read the War and Peace. I'll tell you the best thing. Adopt a grandchild. There are things to do, Charlie.
Sure. The only thing I'm interested in doing right now is playing this game of checkers. Are we going to play this thing or not? Now, Red or black? What do you want,
I'll
Charlie, Frank?
take the red.
Okay. You take red and I'll take the black. It
Oh,
suits my mood better.
Good.
Welcome back. Again, we have Mrs. Butler, Mrs. Bowman, and Mrs. Davis. I'd like to pick up where we left off, Mrs. Butler, about relocating this family and perhaps the effect that it had on their general well-being and their quality of life.
Well, it seems it would have been so much better if the family could have stayed in their own home and community, if at all possible, because having to move to a different place at that stage in life is very difficult. There should have been services that would be available if income was a problem. Services such as the City Department of Human Services or the Texas Department of Human Services would probably have been of an assistance to them. There are income requirements for these different programs. In our program, a couple to receive in-home services, for example, from the Department of Human Services must have an income not exceeding $678.65 per month. For an individual or for a couple, $1,018 a month, with no more than $5,000 in resources. In addition to the income, of course, they must also be functionally disabled in some way. That is, they're not able to perform all the services that are needed to carry out daily life activities. Or they may be not only old, but also a disabled individual over 18 years of age who's not able to perform services for himself.
Okay,
And
how
the
does that
city
differ?
services are just a bit different, and sometimes it makes things a little bit confusing because the city has several kinds of ways to provide home health care services, for instance, along with the other kind of direct services that are offered. We have a little in the way of the income guideline when we are doing services that are contracted through the Texas Department of Human Services. However, we do have an income requirement. With Older Americans Act services, there are no income requirements. However, one must be 60 years of age or older. So primarily for the major portion of city services, it is necessary to have the age eligibility, while we're not going to be too burdened on the other aspects. Generally, if there are income guidelines, they have to do with whatever is the prescribed income level set aside by the Labor Department. And that figure rather changes a bit from year to year, and it would be in the same category as that of the Texas Department of Human Services. At the same time, there are the differences in what the city provides in the way of direct services, because there are two levels of funding, one from the Older Americans Act, the other from Title 20 and from Title 19. And when you get to talking about all the titles, that can cause some confusion. So we just generally talk about it from the standpoint of what the service that the individual would need. And that would include the transportation for medical problems or concerns of a family. There are the congregate and the homebound food assistance programs. There's the matter of family resources where for emergency reasons one might need to have a special kind of assistance that would be available. And there are then the supports from the food bank and from other kinds of services that would impact immediately on the well-being of that family and keeping them in the style of living that they have become accustomed to.
Exactly. Trying to keep them independent, and that's also where some of the community agencies are able to come in, looking at working within their neighborhood if there is a community agency that's already established, as well as church groups. We many times neglect to think about the usual kinds of supports that in general we all have, that at that time we might need to enlist their assistance, say neighbors, friends, but especially church groups, some of the organized groups that we would want to enlist in maintaining their independence, and looking at evaluating that entire situation as it's going on for who can best come in and maintain their independence rather than moving them totally out of that situation. it's quite possible, quite feasible that many things could have been done at that point in time too.
And certainly
rather
when
than
we
this
think of,
shift.
excuse me, the support groups that are needed, there are groups in the community, such as the American Association of Retired Persons, who have splendid programs that would help the family understand how they can relate to the situation that's happened with their grandparents. There are intergenerational kinds of programs that are just positively marvelous in having young persons and older persons paired together. And generally there's a excellent way of communication between older persons and very young children, so they do need help for that 10-year-old that's in that family who could make just the difference entirely in the heritage that the family is going to experience. Normally it's at the knee of the grandparents that the children are going to get this kind of carryover of value for their own lives. And not only would they go to associations and groups, but as Johnny has indicated, there are church organizations, there are club groups in the community, there are volunteer associations who really are there to help both the clients that we serve as well as the families in making this adjustment to aging.
That's right. It is a family thing, isn't it? It's not just one person's problem.
And
There is an
go ahead. I was just going to mention, you look at, they've just lost mother, wife within this family, and the grief that we would assume is going on still because of the anger that Gramps was showing. But that entire family I would see as needing to have a chance maybe to share with us, and you know, we're kind of looking at what we saw here, a chance to talk about that and share with each other, especially, I'm glad you mentioned, you know, like the 10-year-old. This is her learning a way of coping with death, her view of, you know, the elderly, our older persons. So there are just so many.
Yes. There's an excellent support group here, for example, called As Parents Grow Older, that works with individuals who have older parents that they're caring for, or an older spouse even. And it teaches them what to expect in old age and to have a better understanding of what happens to older people sometimes, and also how to deal with these problems. And it's a good support for the family. Often that's such a problem. They don't understand what's happening, and they don't know how to deal with it.
Yes.
And you know, the whole business of the role reversal that is going on, that is very important for the family as well as the Gramps himself to understand. He has become totally dependent upon a situation that is not of his making, and he is somewhat rebellious about that. Situation, and certainly we don't know who the decision makers are. There's another service that is very important to our city office that's offered by the Texas Department of Human Services on elderly abuse and elderly protection, and we don't know just how these decisions were made about who's pulled up out of a community and placed in a nursing home.
That's true, and I think that the older people need to know that they have a recourse, someone that they might could look to and say, you know, is my best interest being looked at?
Exactly. And we many times talk with the elderly specifically about wills and power of attorney and issues like that, like legal assistance, peer counseling, you know, that will provide the service for senior citizens without charge. And when they run into a issue or a problem with someone maybe being overly involved, they will certainly do referrals for further legal assistance. Or like the Guardianship Advisory Board, we can talk about that for those who are in need of a guardian because they're no longer able to make decisions, but at least it's evaluated. And their rights protected is what we're looking at.
Getting them all involved with the advocacy groups that are apparent in the community, and certainly having their affairs in order, and getting started with the advocacy kind of groups, such as the Gray Panthers, would help them realize early on that if I have all things ahead of me sort of set out in the way that I want them to occur, when the time comes, that isn't one of the worries that I will have to face.
Okay. Once more, we'll take a brief break, but we'll be back with some concluding remarks.
Hi, Pete.
It isn't Pete, Dad. It's Dave. Dave.
Dave? Where's Pete? How's fishing today? Great blow fishing out there today. You still fishing in the Sound?
Uh-huh.
Yeah, it's the best place there is to fish. Great blowfish, sea robin. Sometimes you can hear them singing. They're red. You know, that's the way they got their name. They're red and they sing. What you use for bait, Pete?
Squid, Charlie. I use squid.
Best bait there is. You know Maud, my wife Maud?
Yes, Charlie.
She used to live across town, but I think she's moved to gone something. She moved, is that right?
Charlie, she's gone.
Oh. Thought something was wrong. Did she leave a forwarding address? Do I have her address?
Charlie, you've got it.
Good. I'll go see her then when I get to feeling better. Haven't been feeling so good lately.
Charlie, you'll see her.
You know my son Dave?
Yes, Dad. I'm Dave. Dad.
Dave. Where'd Pete go?
He had to go, so I came to see you.
We was talking about fishing, Pete and me.
I know.
You know?
Sure, he told me.
Oh, sure.
Dad? Holly sent these flowers to you. She picked them out just for you.
Holly? Fine, fine. She's a great daughter-in-law, that Holly.
Yes. Dad? I'm sorry that things haven't worked out since we brought you and Mom down here.
She doesn't live here anymore. She's across town somewhere. Mort doesn't live here anymore.
I know, Dad. Dad, what I'm trying to tell you, Dad, I love you, Dad. I don't know if I've been a good son to you, Dad, or any kind of son at all. I've always tried my darndest, but it just doesn't seem like it works out. I hope you understand. I've always loved you, and you've always been a good father to me, a good father.
And you, a good son.
I love you, Dad.
And I love you too, son.
As I promised, we're back again with our concluding comments on what will we do with Gramps. First, I'd like to perhaps just take this opportunity to tie up anything that perhaps could have made an impact early on in this couple's situation. I know that we've hit on a lot of things, but Mrs. Davis, presuming that this man was a veteran, are there things and resources within the VA administration that could have helped him?
Certainly. I guess one of the first things that I think about, like during the time that they were in the park and talking, this man was still alert. We look at the possibility that he might have been able to volunteer based on the employment experience that he's had before, or if he could use the additional income, we would look at employment, like through the senior employment program. There are various services that we would be looking at. We might need to look at maybe some retraining kinds of things because of his disability in using the walker, but there are certainly many things that he would be able to do. We could refer him to like Voc Rehab for an evaluation there, you know, to suggest areas that he might want to look into. That would be one way of trying to keep him very functional. And you look at people who've worked all their lives. This is something that's very important to us. You might want to mention the senior employment, you know, some of the services that we might be able to offer, even through the community by referring.
Well, that's true. There are several services that deal directly with older persons. That age range, for instance, begins at age 55 and is extended through the 90s. It's amazing that there are persons who are working who are past 80 and doing an excellent job in terms of productivity. Another thing that we would want to be certain that Gramps would have had an experience with early on would be the fact that there are things that he and his wife could do together, and that they would be able to have gotten into some learning situations on a casual basis, like lifetime learning classes, or going to one of the universities, or to one of the community colleges for informal education activities that would suit the interests that they had followed, or something that they're developing as they have matured together. We would want them to know, too, that there are such services that are together with the family that is the primary caregiver as they're coming to a later stage where bereavement has set in, and know that there are hospice services. One of the things that was started in this community through the Alamo Area Council of Governments Area Agency on Aging is the hospice service, where families who know that they are going to lose a loved one has an opportunity to get into counseling and understand how the developmental process is functioning and how they can help the person who is actually going to be deceased meet those circumstances, and how they themselves can accept it and understand the process that is taking place. It's an important service for this family, as you notice the deterioration that took place with Gramps after the loss of his wife.
I wonder what all of these changes, you know, had their toll on Gramps. I'm also wondering, and this is only supposition, but perhaps for Gramps' wife, perhaps she was the primary caregiver for a while for Gramps, and I'm wondering what stress that had on her, and you know, if she had had some relief through either daycare that Gramps could have gone to or respite program, maybe that could have helped her.
Yes, very decidedly, because you get so caught up in the service that you're giving that you forget about the ravages it has on your body, your strength, and your mind. You begin to live the life of the person who needs the care, and that is not a healthy situation for the caregiver. You need a period when you can step back from it and concentrate on the fact that here I am, a good person, and I need to have a minute a day or a week for myself.
Well, and also, if they can be refreshed, then they give better care to the person that needs it.
Very definitely.
Exactly.
Really
An alternate living situation might have been a better thing to have done for them, such as foster home. That might have been something that would have been more appropriate for them than the nursing home at that point also.
Giving them a greater measure of independence.
Yes, yes. And they might have been able to have a pet, for example, or to do something useful living in that situation.
I do wonder what happened to their cat.
That cat brought on the broken hip, but at the same time, we do need to remember that in most communities, and certainly here in San Antonio, an important agency is the mental health, mental retardation service. And the mental health that is involved with this family is certainly an important consideration that we would have to assess.
Exactly, and like through Texas Mental Health, Mental Retardation, they have a geriatric kind of service that, you know, we might want to look at, where they would be dealing more with geriatric patients, the kinds of problems that they encounter with being elderly. and some of the organic brain diseases, or say Alzheimer's disease, and how to manage that, as well as the medical facilities. And as you mentioned, we are looking at, say, as Gramps is going through life changes, the supportive daycare that would be able to do some orientation kinds of things, or even some day hospital kinds of groups that would be able to work with him after he is, into that stage of life changes.
Been important for the family also to have had some help in how to deal with him.
Exactly.
To understand it and to deal with it.
An area that we haven't mentioned is also bringing in adopt a grandparent type services. It would be obvious that this couple is missing the endearment that is brought on and the liveliness, the consideration on the part of their children. So getting them involved, even from a daycare center for children, with other children in their household, and usually this is a kind of a little gift exchange thing where on special days the grandparent is remembered, would have been an important consideration for them in their adjustment, especially to a new community.
Exactly.
I think through all of this, maybe we have to remember, though, that, family dynamics have been going on for years and years, and then, it's very difficult to change immediately just when a certain need comes up. But you're right. There's so many things out there if we just know about them and can avail ourselves.
And one of the things I really wanted to point out was there was a lot of support within this family. Just a little bit of information I could see have made a big difference. They were struggling with trying to make the right decisions.
They wanted to.
Really. We look at some of the, resources for providers of services for the elderly, and I just wanted to kind of share some of these. I guess we'll look at the United Way Directory of Community Services is one that we use kind of.
You want to hold that?
Should we hold it? It's called the Blue Book, right? That lists United Way funded agencies, with many of them providing services for the elderly. We talked about employment. I thought this was really neat. Is this? I realize the color is kind of light.
Oh, it comes off well.
Right.
It's so bright inside.
Yes.
Have a happy day.
Hire, don't retire older Texans.
Okay.
Which is neat. Another resource that I also think is very useful for the senior citizens themselves, because it's in big print, is the Number Please, a directory for senior adults. It's in big print, as I said, and it lists them by topics, meals, transportation, or whatever. Another one is the Directory of Services for Older Persons. It's called the Quick List. It's sponsored by Alamo Area Council of Governments. Their area agency on aging also has very good resources in it that we would be able to use and listed by transportation, meals, or whatever services are needed. And also, very good, a bit heavier, by the way, but very comprehensive. It's the Elderly Services Directory. It's a composite listing of services for the elderly. It's published by the joint efforts of the Junior League and the San Antonio Office on Aging, and it's very helpful also. And there are many others. We wouldn't be able to, just go through all of them, and they are constantly being updated, revised. So in working in the area, we know we need to, keep checking with the agencies to be sure what services are being provided. And go ahead.
I feel, ladies, that we've just begun to touch the tip of the iceberg, and yet our time is running out from us and kind of getting away from us. Is there any burning thing you want to say at the end in maybe 2 seconds?
Well, I just think something like in-home services where someone would have assisted the woman, the wife, in housekeeping chores, some personal care for Gramps maybe even some meal preparation if necessary, and these kinds of things that in-home services could have provided might have allowed them to stay in their own home so that they did not have to go into the nursing home, which was obviously detrimental to them.
Okay.
We just want all of the seniors, older persons, to know that there are services available to them and they have the right of access We want them to be able to stay in their homes and have the quality of life that they would plan for themselves, and that they would have it as long as possible in their own homes.
Bonnie?
I agree wholeheartedly. And as I said, you know, there was a lot of support, a lot of good things, and just a little bit of intervention would have made a world of difference, I believe, with this family. So I agree with you.
Again, we would like to thank you for joining us in this discussion on senior issues of what will we do with Gramps. And I think that if you would like to contact some agencies to get specific resources for the elderly, some that you might contact would be the Alamo Area Council of Governments, the San Antonio Department of Human Resources, particularly the Services to the Elderly, your local Veterans Administration Hospital, the American Association of Retired Persons, the Texas Department of Human Resources. For the Audie L. Murphy Hospital in San Antonio, Texas, I'm Lena Adams. Thank you. Goodbye.